Brooklyn's rough where I'm sitting, but it's a good life. Dogs have a good life these days.
Yes.
So it was anyway. So yeah, it's a really this is an evolution. Okay, when I started it, people were getting slammed for doing it. People were getting all sorts of disciplinary action and everything, and now people seem to be doing the grand kahuna of all treatments, and it really is the big kahuna. This is the big one. Many states still don't allow ozone. In the world, you know, it was used in Cuba, it's used in Cuba, Russia, Germany, and now it's becoming more popular. But 25 years ago, I mean, it just wasn't in use. Now, one of the reasons is that the effectiveness of this has become more publicized. People are realizing that the cut, burn, and poison approach doesn't really address diseases. I mean, yes, to some degree, some conditions. That's one. Another main issue is, of course, economics. A lot of people are asking for it, and doctors are saying, wow, you know what? My patients are going to go somewhere else. So I might as well learn this. Okay. And I might as well take some courses in this because, this is a big economic outlet that I'm missing out on. So you got the economic factor, and then just plain good old healing. The word is out that so many diseases are results of poor oxygen, low pH, and this evidence is just starting to pour out. So now it's becoming more and more. Look, when I was doing it, I mean, nobody was doing. People would ask me, "Ozone, what is that? Something up in the atmosphere?" A lot of Johnny-come-latelys came in now, and then they were like, "Oh, well, we're the masters." I really don't care. Listen, let it be out there and let people be healed.
That's awesome. Yeah, and again, I bring that up because for some students coming in, this is probably your first exposure. If you're not involved in the naturopathic or the natural alternative medicine, integrated medicine,
alternative, whatever.
Yeah, but matter of fact, we like to call it the progressive. As a student,
I like the progressive.
Yeah, as a student at the university, that's an important word you want to add into your center, add into your nomenclatures, progressive healing or progressive medicine. We don't even like using the word alternative because it probably is the actual. Everything else is the alternative.
Yeah.
This is the true medicine, essentially.
It denotes that it's something outside of what's being used. They're complementary is a good approach. Progressive is a good approach.
Awesome. So on our last lecture, Dr. Bo spoke on a couple topics. So if you want to take notes on this, first we started off speaking about ozone therapy. We talked about hydrogen peroxide, and we talked about hyperbaric oxygen therapy. All right. So I took some notes from that last lecture, and I wanted to kind of share some important stats and science today, Doc, and maybe have you go a little further.
Yeah.
All right. So medical ozone is what we call triatomic, right? We see this in chapter 2 of oxygen healing therapies. And so triatomic meaning that there's 3 atoms of oxygen.
Correct.
Or 3 atoms, 2 being oxygen, 1 being ozone.
Correct.
Is that correct?
Correct. Correct.
Now, the gas has ozone. The gas has ozone 30 to 45 micrograms per milliliter.
Correct.
In a minimum concentration of about 95% oxygen.
Correct.
Is that correct?
Correct. Correct.
So it's 95% oxygen, 5% ozone in the mixture.
Yes, absolutely. And this is important from a chemistry physics perspective because people, like when I first encountered this, it was like what you're putting. One of my friends was doing this. Are you putting gas? Are you putting air in a vein? It looks like air, but it isn't. So the mixture, as you said, is 95 to 5, 35, 40, 45, 50. When you drop to about 10 micrograms, the efficiency seems to diminish. So that seems to be the magical number to create its effect. And the effects of ozone are, I mean, it's astounding. I mean, this is something that's been used in Germany for over 100 years, something that's used in a third world country like Cuba. People used to go there, and I think I mentioned that to you. They used to go there, and when I was in Russia in one of my lectures, they said, "Oh, look, we set this up in Cuba," and I was like, "Wow, dang! Now it makes sense." Third world country, no food, no drugs, no medical equipment on the shelf, but they have something so simple: oxygen an oxygen tank, a generator. And whammo, you got an ozone oxygen mixture that's very effective. And those percentages seem to be like the optimal therapeutic range.
Awesome. So you're saying, so the percentage of about 30 to 45 micrograms per milliliter, okay?
Yes.
And anything, this is good notes for you guys to write down. Low doses, 10 micrograms is not effective.
Yeah, 10 to 15 is not effective. High doses can be toxic to the extent that they can produce a lot of oxidative change, oxidative results in the body. But you know, the glutathione, SOD, catalase, these are antioxidant systems that we all have. And once again, this relates to nutrition. See, all this ties in with nutrition and lifestyle. The superoxide dismutase, the catalase, the glutathione from food, from what we produce, breaks down the toxic products, the oxidative. See, there's oxygenation and oxidation. It's the Jekyll and Hyde. You want to oxygenate the body, but then there's a breakdown of oxidation. And that's like the unpaired electrons joining and hooking up with different components of the body, possibly causing injury and destructive change. But the body has mechanisms to mop this up.
So, and this oxidative stress, we would call it, basically this is free radicals, is that correct?
Exactly.
Okay.
That's exactly what it is.
So, ladies and gentlemen, when you hear that term free radicals, what Dr. Bo is speaking on here is this oxidative stress. And a good example of this would be like cutting an apple in half, leaving it on your countertop, and within an hour or two later, you see that the apple becomes brown and whatnot.
Precisely.
Okay, so that's
rust on metal, see it on apples, you see it on fruit, and it's just a natural component of being coming into contact with oxygen. That's it.
Gotcha.
It's natural.
Great, thank you for that note. And as you guys are here in the lecture, if you have questions, feel free to put them in the chat box. And then what we'll try to do is by the end of today's lecture, answer as many as we can. Right. So one of the main areas that you've always spoken about and have great success in your clinical research is ozone and viral diseases. And I know this is in the later part of the book here, but viral diseases, things such as herpes, HPV, HIV, even now COVID.
Yeah.
Can we get into that a little bit?
Yeah. And you hit the key word there, Reverend Doctor. It's called research. We're a research institution. Our students, our graduates are engaged in research, spiritual, scientific care counseling research. We don't diagnose, treat, we assess, we address, and it's all research. And we're keeping data, and the benefit of research is that it impacts and it benefits future generations. So as far as like one of the key benefits of ozone is that it can kill viruses, whether it's outside the body or inside the body. We know that viruses are non-living. You know, they're DNA and RNA viruses. They have like this weird shape with legs. When you look at them, it looks like something out of a sci-fi movie. They attach to cells, they actually ingrain into the DNA, and they become part of your genome. So the ozone, you know, the viruses either have a protein coat or a lipid coat. Okay, so the ozone effectively destroys and peroxidates the coat on these entities. And what implication does this have for disease? Tremendous implication, because there's so many viral diseases out there that if you have a way of preventing these from adhering, you're ahead of the game.
Awesome. So basically the effect that it has on these viruses is that it's breaking them down, just breaking them apart.
Yeah. It breaks down the sulfhydryl coat, namely, you know, these viruses have a coat, as I said, they have, it's either protein, lipid, and they have spikes. You know, everybody now, people hear about spike proteins and everything, they have spikes. It deactivates the spikes, and it's not that the virus is killed directly, the virus doesn't have a chance to adhere to the cells. And a lot of time, these viruses adhere to the CD4, the T helper cells, and that's why in a situation like HIV, T cell count goes from like 12, 13, 1400 to like 200. And what happens? Secondary infections come in. So these, the peroxidation effect of the ozone hits the viral envelope. Virus is deactivated.
Right.
It can't do damage.
Just breaking.
You're gonna get it. We have viruses all day, every day. We have about 3 to 6 pounds of microorganisms living in our body. We have it. You can't help it. But you're going to break it down so they don't become destructive.
Awesome. All right. So, Doc, my next question I have here for you is, What about cell signaling? We know stem cells do this. Transcription factors, including type 1 alpha nuclear factor, K beta, are impacted by ozone. Is this correct? Is this valid?
Yeah, very, very important point there, Reggie. Now, as far as cell signaling, what does that really mean? Like, these components will actually create signals that impact the physiology, the transcription, transduction, the division of the DNA inside the cells. Now, what else does this? Stem cells. Stem
Right.
cells are known to be cell signalers. Okay, so stem cells, directly and indirectly, will, through different mechanisms, the paracrine effect is one of them, attach, join signal cells, repair cells, and the ozone has a very similar effect. So if you can introduce a substance to the body that impacts such an important physiologic component as cell signaling, you're actually changing the physiology of the body.
Amazing.
Yeah,
it's amazing.
yeah, it is.
And I know I didn't actually write this question down, but listening to what you're saying, is this something that maybe our students are listening in? Do you wait till you get sick to do this, or is it something that you should do on a maintenance?
Well, I could show you my veins, and I know your veins
Yeah.
too. And look, this is a great tool for preventive maintenance. Okay, as the Chinese say, like don't start digging the well when you're thirsty. Okay,
Right. Yeah.
that's treating a disease after it manifests is like starting to dig the well when you get thirsty. That's not the time to do it. So by doing ozone, different forms of oxygen therapies before you get ill, you're preventing the illness. I mean, and there's something called ozonoids. These are the breakdown products of ozone, that last in the body days, weeks. Okay, so you have these ozonoids that are kind of like an auto vaccine. Okay, you're doing a vaccine.
Right. Awesome.
So the benefits are tremendous.
And I know we have some research on vaccines we'll be working on in the coming year, but that's for a different lecture.
That's a whole different area. Yes.
And Dr. You kind of talked on this on my fourth question, but I just want to make sure that our students really get this down. So, in fact, based on what you just said, ozone is believed to damage the lipid and protein coats.
Correct.
Right? And
Correct.
preventing the viruses from adhering to the cells.
Replicating,
So-
adhering, yes.
So if you're listening, and that's an important note,
very
very important to write down, right? So ozone is believed to damage both the lipid and protein coats of viruses, preventing them from adhering to cells. Make a note of that, please. It has also been shown to damage the spikes, as you mentioned, in the viruses,
Correct.
which is we're hearing more about that now.
Correct.
And just to go a little further with this, how does this relate to the C4 T helper cells? This is, as you were mentioning earlier.
Those are the cells, as I said, when that drops, the immune system can no longer adapt and deal. There's an acquired immunity and an innate immunity.
Mhm.
So the acquired immunity, both forms of immunity, like children have a high degree of innate immunity as we grow older. The thymus gland, the T lymphocytes, the B lymphocytes handle that. This drops. So once those T cells or CD4 cells drop, anything can set in. And the ozone, surprisingly enough, has more of an affinity to the lipid capsid viruses than the protein. It does break down the protein ones, but for some reason, the peroxidation takes place more readily with the lipid ones.
Awesome. Very cool. All right, so then my next question for you is ozone and heat shock proteins, especially numbers 60, 70, and 90. Let's go into
this. This is an amazing area because we talk about sauna all the time. We met over, I think a quarter of a century, maybe more than 30 years ago.
Yeah.
So 30 plus years ago. We spoke about sauna, and both of us being martial artists and sweating and athletes, we love sweating, we love sauna. You just got a nice new one there for your home. Sauna heat hypothermia creates heat shock proteins. Now, what are the heat shock proteins there? Heat shock and cold shock proteins. These are chaperone proteins. They just kind of emerge out of nowhere. They still don't know where they emerge. The smaller ones, HSP, 40, 50, you get 60, 70, 90. The bigger ones, each has a different physiologic effect, but the ozone increases the quality and quantity oxygen therapies of heat shock proteins. Now, what do these do? These are chaperone proteins. Cancers and other diseases arise from these proteins being deformed. It's like folding, like you had a whole bunch of towels in there that are in disarray. They come, the ozone, the heat, different mechanisms goes in and folds the towels and makes everything neat. So it reformats these proteins, and they're beautiful structures. When you look at them in 3D, they start out linear and you see all these 3D shapes. It takes the proteins that are damaged and puts them back in an undamaged form. So this is very important. Damaged proteins will cause disruptive disease, Alzheimer's, dementia, arthritis, cancer, to name a few.
Wow. Awesome. All right. So then some chapter 5, chapter 6 in this book talks about, ozone in cancer, ozone in AIDS, ozone in herpes, ozone in COVID.
Yeah.
Can we just talk a little bit about, let's start with cancer, ozone and cancer. I know
Yeah.
you just touched on it for a moment. But
The cancer industry is such a powerful industry, and it's interesting. I was in New York. I was the man of the year back in.
I was there.
Yeah, you were there.
Yeah.
You were there, brother, in 2000, 2008. This
Yeah.
is like a century ago.
Yeah.
And even back at that point, they were looking for adjunctive, holistic, integrative approaches, even though it's a very rigid industry because there's a lot of money there, there's a lot of economic variables there. Drug companies are involved, supply companies, technology companies. So you look at something like oxygen therapies, it can't be patented. Okay, so being that you can't patent this, that's why people used to go to Cuba. Like I said, 50 years ago, I'd hear people going, well, why are people going to a third world country for cancer? Because they weren't getting the results here. Word got out, they go get ozone, come back, a lot of them were feeling better. So at the minimum, ozone should be considered as adjunctive therapy for cancers. Now, as I said, it's a very controversial arena, and what we call evidence-based research is not really there in any quantitative, in any voluminous degree, and you're seeing things come out bashing it, skewing it, people get injured, they die and everything. It's not really true. And the word cure, see, like the FDA categorizes certain treatments as cure. However, ozone can never be termed in the same category as cure because it's non-evidence based, but a lot of evidence is now coming out to indicate. And look, when you look at Otto Warburg, Nobel, who's a good friend of mine, Klaus, he died recently, and a picture of him holding my book with me. The Nobel Foundation awarded the Nobel Prize twice to Otto Warburg back in the 1930s for his work on low oxygen and cancers. Okay, now the modern interpretation of this is like, well, he really didn't mean that low oxygen causes cancers, but if you look at the cancer mechanism, the biophysiomechanics, the pathology, pathophysiology of cancer, there's always the glycolysis pathway in the Krebs cycle versus the oxygen pathway. So it eats sugar, produces sugar, sucks up sugar. So the ozone, the oxygen will stabilize that, create a higher pH, a more oxygenated environment, and you're going from the glycolysis to a different pathway that's more conducive to cancer cells being destroyed.
So it's amazing. And I know we're going to get more into uses in a moment. We'll get into some different methods of administering ozone, but just in general, the idea of just cutting sugar out, right? I mean, just cut cancer really just manifests on sugar.
It does.
I know stress and other things, oxidative stress you talked about earlier, all that should be considered. But when we really think of the impact that sugar has, and this is packed in everything,
including especially the high fructose, it's definite poison. And sugar feeds cancers. We know that. I mean, that now that's common knowledge. because it shifts the metabolism to a glycolysis
Right.
pathway.
Yeah.
And the more you feed it, the more these cells become active.
And you have these children, and I know I'm getting a little off topic, but
No, it's
yeah,
very
as we have
important.
these discussions, you have these children that they get this really nice advertising, Frosted Flakes. I mean, it looks appealing, it's colorful, and you see these
Amazing.
things on TV.
Yeah.
And when we're talking about banning things, we're talking about what's legal and what's not legal. And this is just my humble opinion. I have to
Yeah.
be very clear on how I state this, but that's more addictive
Oh yeah.
and for children, and that's more
Oh yeah.
something that you're kind of playing on the minds of the youth.
Oh my God.
You're addicting them
We
to
grew up
sugar.
on that.
Yeah, probably more than what we hear about, like, everyone's worried about cholesterol with heart disease and this and that.
Oh, yeah.
But probably even worse is sugar.
Oh yeah. Well, those industries are competing industries, and it's apparent now that the sugar industry blamed the fat industry and started coming out with this cholesterol stuff. In fact, cholesterol protects against cancer.
Yes.
That's been shown. But in order to take the spotlight off the sugar, well, high cholesterol and all this, so all of a sudden everything shifted. And then nice and quietly, they started putting the high fructose in there, 55%, 45%. And then now you got pure poison.
Yeah.
And this is one of the reasons that children are developing all this ADD,
Yes.
ADHD, and all this other stuff. I mean, but this is, look, soon, at some point, we pray at some point, this will be verified to be harmful. I mean, look, I'm older than you, so when I was like 7, 8 years old, I used to go to the pediatrician's office. He'd have a cigarette in his hand.
Oh yeah.
I come out of the office smelling of cigarette, and I was wondering, why do I smell of cigarette smoke? Why is this guy smoking? But my mom was smoking. Everyone was smoking. The AMA didn't even dissuade smoke. There was smoking commercials. More doctors recommend the smooth cigarette, the one that's less irritating, calm your nerves. Same thing today. Sugar.
Yeah.
A lot of the cut, burn, and poison. These are archaic, antiquated, barbaric systems. Even President Obama said way back, he said, we have a medical system that's antiquated. It's useless and it's defective. So this is the new paradigm. This is one of the cornerstones.
Yeah. So I apologize for getting us so far off the oxygen healings topic, but I think for our students listening in, really examine and research the negative effects that sugar has on the body, because it's really wreaking havoc. All right, so then the other topic here is ozone and AIDS.
Yeah. AIDS, back in the day, and there's a book that I recommend everyone reads, The Real Anthony Fauci. It is a great book because everything is documented. Robert F. Kennedy is a man of great courage and virtue, and he talks about about the whole politics of the AZT, how it was shown, it was known back then that AZT was poison and it was going to kill people. And that's exactly what it did. And then when when people woke up to the reality of it, they realized, wow, this is not addressing AIDS. And a lot of back then underground circles started discovering oxygen therapies and ozone. And AIDS, HIV is a fragile virus. We have seen in our research so many cases of AIDS being knocked down, of HIV being inactivated. Once again, our students are research specialists, they're research physicians, they're research naturopaths. So the effectiveness of ozone in herpes, cytomegalovirus, AIDS, hepatovirus is phenomenal. Okay, you have you have these protein viral coats and and immediately it starts knocking them back. And a lot of times, as we said before, with these viruses attack the immune cells and start knocking down the T cell count, the CD4, the helper cells get destroyed. But if you do enough ozone, you're going to keep these at bay. So you may not be totally virus free. And we see so many people now. I mean, it's just epidemic, HPV, leading to throat cancer, cervical cancer, all sorts of cancers. You're going to knock it down to the level where the the immune system's efficiency is going to be far greater than the destructive ability of the viral component of bacterial or fungal, because it works against bacteria as well, works against fungi, it works against basically all microorganisms, because most of them are anaerobic, they're not aerobic.
Awesome.
Yeah.
And anaerobic meaning lacking oxygen.
Right, and they thrive in a non-oxygen environment, and they in fact create a non-oxygen environment, and they produce an environment that protects them from the ravages of the immune system, so the immune system doesn't actually recognize them.
Awesome. So Doc, as we continue to move forward, what routes of administration are used? What routes are effective?
There's so many different routes, and that's the beauty of this. Now, one of the most common routes, of course, is the IV route. Okay, so autohemotherapy is one of them. You know, people dissolve the ozone in saline or D5, or, and they run it through. It's that kind of works okay, but a lot of the ozone is broken down by the time it gets to you. One of the more efficient routes is taking blood, using an anticoag, which we recommend the non-pharmacologic kind, the ACD, and running it back in the body. So this is a form of IV autohemotherapy, and the beauty of that is that we spoke about this last time. The oxygen dissociation curve and oxygen saturation becomes high because the red blood cell has 4 heme, 2 alpha and beta, 2 units of each on the receptor, and these become saturated. There's about 270 million of these in each red blood cell. Okay, so I mean, the red blood cells become saturated, they go in the body. Now, when we use light in addition to this, what happens is the electron configuration in oxygen, you have 3 orbital configurations, 2, 2, and 4. When you hit it with light, there's an excitation like the aurora borealis, like the northern lights, goes to the highest orbit. Energy goes from high to low. These cells now connect with sick, dying, damaged cells, and they discharge their energy, and you have energized, ozonated blood coming back in the body, which is like phenomenal.
Which is like frequency medicine.
It is free. Oh, and that's the other thing. We hit it with frequency. Like, this frequency. Oh no, we have a couple of trademarks here in the university. We use, thank you for reminding me. We have, and there's so many different techniques. We have frequency enhancement of this as well. Once we do scalar assessment. Now other routes, intramuscular. I developed this system where I put this into the meridian system, and the meridians, the points, are the pathways that connect. It's like the highway ramp into the underground circuits that lead to the different target organs. Rectal application, phenomenal. A lot of the COVID has caused injury, this so-called long COVID, and we know this virus was created to wreak havoc. I mean, it's obvious it didn't come from markets and bats and fruit flies and all this other crap that people talk about. This was something that was created in a laboratory that's already confirmed, according to so many different sources. And a lot of it settles in the gut, and there's a depression that comes out of this because the gut is responsible for producing 90-95% of serotonin, which is feel-good chemical, some degree the dopamine. So the ozone, when it's done rectally, and even when it's done systemically, IV, IM, goes and cleans out these spikes, deactivates these viruses in the gut, allowing the gut to produce more serotonin, allowing you to be happier and deal with situations more constructively. Now, vaginally, for women, one of the best methods, there's a little applicator, go in there. It basically goes through the canal into the reproductive organs. For men, rectal application is good. You could do it by ear, like this instrument that looks like a stethoscope. We do it, there's something we call Ozone that I created. It's a trademark patented technique. We use it with mineral salts. So the salt that's administered with the ozone knocks down, makes the pH more amenable for the ozone to work, more alkaline, brings down the inflammation, so the ozone becomes more effective. You could do ozone or in the form of
We
peroxide.
spoke about that last week.
Yeah, peroxide is a very good, it's going, you increase it by 1 drop every day, glass of water, you can do 2-3 times a day. And it's going through the stomach lining and you're getting hyperoxygenation in the system. You can do it in the skin, ozonated oil, you can you can bathe in it. So there's so many different techniques.
Awesome, awesome. So what about risk with ozone and oxygen therapies as compared to drugs, surgery, and pharmacology?
Well, we know the percentage of iatrogenic problems, doctor caused, surgery caused, procedure caused, is in hundreds and hundreds and hundreds of thousands, hundreds of thousands. We know, having done anesthesia for many years as an anesthesiologist, I've seen the complications with anesthesia. I mean, really, I mean, they can be very severe. You need it sometimes. Look, you're always going to need emergency care. You're going to need surgery. You're going to need that's always going to be a component of medicine. You can't get rid of that. No shaman holding chicken feathers over someone's head is going to cure a broken bone or a heart attack. Ain't gonna happen, you know. So you need this. You need all of these procedures. But if you look at the complications reported, and even if it wasn't reported, trust me, it would be discovered and the doctors would be hung to dry, like something like 0.0007%. I mean, it's minuscule, okay, minuscule.
Yeah.
And that's why, like, operator, technique, investigator in our nomenclature, research physician, experience and training is very important. But it is a relatively very, very highly safe technique and method, provided that you do good medical history, you check the person out and you see what you're addressing and your own level of training and expertise.
Yeah, awesome. How about contraindications?
There are really very few. I mean, I can't think of an absolute contraindication to this because like this is used all over the world in many different countries, and it's growing, and the effectiveness rate is pretty high now. If you add certain things to the drip, that there's an extracorporeal EBU, they call it EBU. They take the ozone out, it's like a dialysis, they put it through filtration systems and membranes, and they add certain stuff, heparin and other stuff like that. So you might have reactions to some of the additives, other components, but the ozone itself, done judiciously, done with care, should be, I mean, it's a relatively safe, and it really doesn't have any absolute contraindications.
Yeah, because in chapter 7 here, I mean, they just get into biooxidative therapies, which is what we're talking about. And I mean, bronchial asthma, they're talking about burns, they're using it for diabetes, for cancer,
diabetes. That's another thing. Now, heart disease. This is like one of, if you look at, if we go over some of the things, and the list is so long. It will take like an hour to do it. Hundreds of applications, fungal, hepatitis, heart disease, pain management, stroke, post-stroke healing. The sooner you get a person to utilize ozone therapy or hyperbaric oxygen therapy, the faster wound healing, you're going to get a much more comprehensive and faster healing. Like, and when you split hairs on this, you're looking at ozone therapy, great for virus infection, regenerating the heart. We've seen this. I mean, so many patients, so many people, post-stroke care, pain, right into the vertebrae, into nucleus pulposus in the collapsed discs. Now, hyperbaric oxygen therapy, if you look at those components that are compensated by insurance companies, you have carbon monoxide poisoning, you have gas gangrene, you have osteoradionecrosis, necrotic tissue following radiation therapy, you have crush injuries, you have, of course, decompression illness. So they're kind of different. They both drive oxygen into the body. Hyperbaric oxygen therapy drives it under pressure. With ozone and peroxide, you don't have pressure. You're just kind of administering it, whether it's through the muscle, rectally, anally, through IV, through the ear, through mouth. So the you know, the applications are a little different. All will benefit every situation. With hyperbaric, you have to watch the ears and you have to make sure that you don't have the person doesn't have a respiratory infection. You know, so there's got to be like everything else. You have to have some sort of clearance and history.
And I know towards the end of the book, and we're also going to give everyone an assignment, some little research to do. So please stay with us throughout the rest of the class. But chapter 11, we talk about other methods we can use, you know, either in addition to ozone, or if we don't have access to a practitioner of ozone, other methods, things like qigong, yoga. Can you go a little?
Yeah. Oh yeah,
into
yeah.
that?
Well, we both apply these. We've been applying these to our life, and that's kind of what brought us together, the martial arts circle, and sharing the knowledge. You know, applying it, doing it ourselves. Qigong hyperoxygenation is important. You want to be more on the oxygenated side. You want your oxygen saturation curve. You want the partial pressure of oxygen up there, and you can measure this with a pulse oximeter. Back in the day when I was doing anesthesia, we didn't have all that fancy schmancy stuff, so you had to kind of look at the eye and see if the person was anemic. Nail beds, you had to look at the pulse. So qigong is a great component, is a great method. Yoga, rhythmic breathing, you know, like all sorts of breath work, shamanic breathing. One of the other means of increasing it, surprisingly enough, and this is getting a lot of exposure today, is methylene blue. Methylene blue is one of the original stains. It's the first stain that was used to stain shirts and stuff. It's crazy. And we used to stain tissues with it after we took biopsies. And that plus colloidal gold plus red light increases the oxygenation, and it's used at the minimum as an adjunct for cancer therapies. Now, speaking of light, red light also increases oxygen in the body. It's interesting because once again, let's go back to let's break down the biology, the chemistry, break the chemistry to physics, break the physics to math. When you look at the orbital configuration, a lot of time when you talk about low energy in a person means low energy in the cells, means low energy in the electron configuration. You're hitting these electrons with light, you're bringing to the highest orbital configuration. Okay, what are you doing? The O2 molecule is now more active. You're driving more oxygen into the body, and the body is benefiting from the oxygen. Right. So that's why sunlight is one of the most natural ways to get oxygen.
And they say, and our logo says, "Let there be light." So
that's right. It
has to be something to that, right?
Let there be light, bringing light to enlightenment. That's what we do. It's all about light, the light of God.
And so simply just getting the red light therapy machines, I know we can get them through the university. But just holding those in positions on, let's say, the carotid artery, or holding them just over the heart, does that have benefit?
I do it every morning.
Okay.
5-10 minutes. You hit it in every component. And one of the ways to increase it, and this is in PubMed, using colloidal gold, which is tiny nanoparticles of gold, combining it with methylene blue, 5-10 drops, and then hitting that area with light. There's studies showing that with breast cancer, the cancers will start improving.
Wow.
Okay, so you're going to see a lot more stuff coming out in similar topics, but light is very, very important. Also, different wavelengths of light, like if you look at UV A, B, and C, like the 200, 300, 400 nanometer range, great for viruses, bacteria, microorganisms. You get to the LED light in the 6, 7, 8, 900 nanometer range, great for tissue repair, for collagen repair, for skin repair, for immune system boosting. So light is a very, very powerful. That's why we use ozone with light.
And it's it's interesting because again, what's been laying dormant for 25 years. I remember again meeting you, and back in the 90s, you were talking about ozone therapy. Nobody was doing it.
Nobody knew what the heck I was talking about.
And
people were getting arrested. They were getting carted away. They were losing their licenses back in the day. And now every Johnny come late. It's okay. Let them come out. Let everyone claim to be the king of the throne. Let this get out there because the world, society needs this. There are going to be more pandemics, more epidemics unleashed on us. And I say unleashed, not happening spontaneously. This is all natural. This is all planned, programmed, and this is going to be one of the cornerstones of removing or at least dealing with it.
And I meant I'm using that because now I see red light just about everywhere.
Yeah.
Driving down the road, I see,
Yeah.
medical spa, wellness center, red light therapy. So it's like this has been laying dormant as well,
Yeah,
right?
people realize that people don't come, look, you can get any info on the internet on anything today. It's like, what I say, I think
People
the
like
person
businesses.
the person living in the Kalahari Desert today has more information at his fingertips, the same information that a president of the US had 25, 30 years ago.
Yeah.
Okay, so you can get it, and people are seeking it, they're looking for it. So if for that reason alone, practitioners are saying, wow, our practice is drying up, we better connect with these people, or they're gonna go somewhere else.
Right.
So they're starting to learn it.
Right.
So now you
But-
have this amazing explosion in this.
Absolutely. But really having technique behind it, having good intention. And this is important as students of our university. Intention is important. Technique is important. You're learning a lot today, but we're not telling everyone, go out there and start doing IDs. You got to put in your time. You got to learn the techniques. You got to put in your clinical experience. As students of a research university, you want to make the trips out to our research center in Queens, sit alongside Dr. Bill and our professors and doctors, and really understanding, get deeper into it. Which brings me up to a little assignment for everyone. So if you do not have access to our discussion boards, please email me. You can email info@uhss.nyc. Again, it's info@uhss.nyc. And just put your first name, last name in the email along with your email address. We will invite you into the discussion boards. Today's course is in our master's program. So the space that you're going to go to is called the master's discussion board space inside the master in that program. And the assignment for you is to research and compare the benefits and applications of ozone therapy and hydrogen peroxide to hyperbaric oxygen therapy. So we would like for you to research and compare the benefits and applications of ozone and hydrogen peroxide to hyperbaric oxygen therapy. And in that discussion board, I'll be available, Dr. Bill will be available, our other professors will be available to kind of comment, and we'll go a little further with that. Do you need to hear that again, or is everyone okay with that assignment? Thumbs up if we're good. Awesome. Very cool. And Dr. Bill, I think that's is it for our lecture today? Jay,
Just
points
a
you wanna
couple
bring
of notes that I didn't mention, like, when this so-called pandemic was first made public, I just had intuitively, I had insight, and I knew where this was going. There was, right now to date, something like $90 billion was made in profit by pharma from this so-called pandemic. And we knew that oxygen therapies could, even though these are viruses that are created in a lab, these viruses could be deactivated. Like one of the and we saw this, and I mentioned this to you at the very beginning, the clinic in Ibiza, the Nuestra Senora del Rosario Clinic, and they started treating COVID, just as we have a lot of research experience with COVID and documentation that the activation of COVID, within 2-3 days, COVID was being knocked out. They were using ivermectin and hydrochloroquine. There was no need for this remdesivir, which received like 79 billion in funding. People were dying from it, people being intubated. This is also going to be looked back upon as a barbaric milestone in medicine. But if you look at the effectiveness of, like we said, AIDS, HIV, COVID, now long COVID, ozone is one of the tools that is tackling long COVID. So, I mean, the applications of this, I invite you to do your own research and take this to a higher level. This has been, just an introduction to it. This could be a 30-hour lecture right now. And I just wanted to pretty much give you the fundamentals, the foundations of oxygen therapies, because it's so powerful. I've been involved in this. You've been involved in this for over 25 years. And it's something that, you know, that has to be out there, and,
Yeah.
and it's getting out there, thank
Awesome.
God.
Yeah, ladies and gentlemen, we basically went through just about every chapter. It's not a big book here, so if you don't have it, you definitely need it for the course. But we basically touched a little bit on every chapter. The one chapter that we didn't get into really much of, but we could just do a quick little end with, is the chapter 12, which is emotions, mind, and spirit.
Oh,
You know, the fact that we are a health and spiritual sciences university, it is important that you understand the intention, the mind. You know, the mind will give up oftentimes before the body, right? Someone's even simply as running, you know, also, oh, it's too hard, and then they give up. But we can really push through with a strong mind, strong spirit. We can do a lot. And as a healer also, right?
Yeah.
Your intention when you're doing the healing, when you're working with someone, is extremely important. Because if you're haphazardly doing things, one, it's not the right protocol. Two, that spirit, that energy, is not going to help with the healing curve.
yeah,
Is that
yeah,
correct,
we
Dr. Bill?
bring the spirit. This is why we're teaching everyone Qigong, Tai Chi, Kung Fu, all this stuff in our teaching protocols, because we bring the warrior spirit. You and I, we both have, and the people who are involved, they're all learning. We bring the spirit into the healing spirit, into the spirit of eradicating health challenges. And God knows, you know, how many times I've been challenged by those that do not want us doing this type of progressive work. I stood up to them, and thank God, you know, look, I'm still here standing. We've had numerous challenges, and you have to have the spirit of the warrior. You have to have the spirit of the fighter. You can't give up. And like you said, when the mind gives out, like we both have that warrior spirit, the indomitable spirit. When the mind gives out, forget about it, because the mind can keep the body going. And was it Viktor Frankl? This guy survived 5 concentration camps of that Hitler threw him in 5, not 1, not 2. And he said, he who has the why to live can find the how. So when you're objective, when your mission is clear, and you're here to do God's work, the work of the divine creator, help people find peace, comfort, eliminate pain, and help people have a better life. Well, that to me is a life fulfilled, and that's
Absolutely, yeah. And it's important to help our patients, help the people who are coming to us for care, for them to become spiritually attuned. Oftentimes, you know, people, oh, I don't believe in a source, I don't believe in God, until it's too late, right? They're in a foxhole, and
There's
then
no
all of a
atheists
sudden,
in foxholes. I've
you
seen
know,
that a lot.
yeah. And then all of a sudden, they're, oh God, please, right? So,
Yeah.
On page 205 and page 206, you know, there is a great thing here, something to do, whether it's praying in private or praying over a patient, or helping them to kind of connect with their divine source, is important. So here it says, I am created by divine light. I am sustained by divine light.
I love it.
I am protected by divine light. I am surrounded by divine light. I am ever growing into divine light. And this is page 205, 206. There's a reason why this is being brought up in this course. The patient has to be, their intention has to be connected in a positive way with this type of healing. This is not like I take a pill today, then my headache goes away in an hour. There's a different mentality, a different mindset involved in naturopathic medicine.
Yeah, very true. And we pray every time we do a procedure, every time we help someone out, we pray. I mean, I'll tell the person, we pray together, we pray internally, we put the intention into it. And you know, like the funny thing about oxygen, like aside from hydrogen, one of the most abundant elements, is that once again, the electronic charge, the orbital configuration, it'll pick up the frequency. And it's all about frequency medicine. In the Atlantean times, it was frequency medicine. Going forward, it's going to be frequency medicine. It'll pick up that frequency. If you're doing this, engaging in some form, shape, and you or people in a room have fear, they have anger, they have hatred, that procedure, that component, that element is going to pick it up, and it's going to go right into the person receiving it.
And teaching your patients, the opposite of fear is faith.
That's right.
You know, the opposite of sorrow is joy.
Exactly.
You know, it's important that they learn this. We had one patient, and we'll wrap up. He just wanted to see he wanted to see his son get married, and he had a glioblastoma stage 4.
Oh, we kept him alive for a long
years,
time.
you know, but really, of course, the healing, the therapies that we administered, but in addition to that, every week I met with him 3 times a week. I remember
Amazing.
that praying,
Became Thanksgiving
right?
Day.
Yeah,
He
and
came to the office.
and you had the opportunity because I just want to have the opportunity to see my son get married,
Yeah.
So intention is very important. Fear, opposite of fear is faith. Opposite of sorrow is joy. These are the things that we have to be presenting to our patients as we're working with them. So ladies and gentlemen, thank you for joining us today. We will be uploading this video. Again, please submit that assignment. Do your research.
Any questions, maybe, if they?
Absolutely. Any questions before we wrap up?
I know I gave a lot of information. We both did in a short period of time, but it's a nice foundation for your own research.
If you have a question, feel free to unmute yourself or you can post it in the chat box.
And there are no stupid questions, trust me, man. The only question that's bad is the one that's not asked.
Absolutely. All right, so please work on that assignment, and we will look forward to seeing you guys. Coming up in January will be a four-week lecture series on Qigong. And Tequila, I see you have a question here. Okay. Where should we upload the assignment? That's going to go in the master's space. There's a space that says master's discussion board. This is the master's degree topic, so that will be there. Perfect.
And Tequila's doing great. My little one used to say when he was small, 3 years old, I'm proud of you. I'm proud of you, Tequila. You're doing great. Picking up a lot, learning a lot.
All right, ladies and gentlemen, we'll see you soon. Have a great evening. Thank you.
God bless.
God bless.